My name is David Hirschy, and this is Marcella, my wife. About 2 years ago, I had a colonoscopy routine, and one polyp was removed, and nothing, it wasn't a serious kind of a polyp. And around that time, I lost my appetite, and this was fairly alarming since I have worked as a chef. Food's been a huge part of our life, and so I knew something was really wrong when food was not tasting right. And along with that, I lost a lot of weight, and then my hair fell out and my nails all fell off. And so by this time we were fairly alarmed and went through the normal medical facilities and resources of our hometown in Prescott, Arizona, and basically no one could figure out what was happening. I knew something was really radically wrong. So we came to Mayo about 1.5 years ago, and essentially at that point I knew that I was dying of something, and that if there was no intervention, that it was not something that's going to get resolved. And so we went through a fairly extensive evaluation, and at that time we met Dr. Luciana Funtowitz, who was in charge of that process for us. We met Dr. Lucinda Harris, who eventually became the point person for the team here at Mayo.
I repeated his upper endoscopy and found that he has sort of a diffuse nodular presentation and inflammation, and sent his slides off to the pathologist here at Mayo Clinic.
I received 1.5 years ago almost biopsies from Dr. Harris regarding a patient that had quite severe injury, atrophic injury of the stomach and of the duodenum, to a degree that was quite unusual for its severity. The examination of these biopsies associated with clinical information I gathered from the electronic record led to the diagnosis of a very rare syndrome, Cronkhite Canada syndrome. When I received the biopsies, I was stunned. The degree of atrophy was so remarkable and across different organs. The interesting aspect of the case was that we detected this rare disease early in the course of a disease. And I think that offered a better chance of therapy and cure, if possible, in these cases, to this patient.
Cronkhite Canada syndrome is a very rare syndrome. It's a non-genetic syndrome where patients have hamartomatous polyps, and they can actually come down with colon cancer eventually. They oftentimes don't do well because it's not discovered soon enough, but in his case we discovered it, and I started to look at the literature, and I saw that one of our own gastroenterologists up at Rochester, Dr. Lisa Boardman, had seen a great number of cases of these patients. And so I contacted her, I read her articles, and so had an idea that his treatment was going to require use of prednisone and azathioprine.
Fortunately, Dr. Harris and Dr. Funtowitz have both consulted with Dr. Boardman, and that team approach, I think, is part of the reason that I'm here today and enjoying life each day. I would say that the kind of monitoring that goes on, the teamwork, has essentially had a tremendously successful outcome in the sense that things are stable. My weight has stabilized. There were a lot of things in our life that went on hold. Our normal work as silversmiths, the recording studio, so that once we had this thing stabilized, that all of those things returned, so that I can taste, we can eat, we enjoy food, we continue to work as silversmiths.
All in all, I think we're handling this little bump in our lives with grace, with positive energy, with humor, and most of all, we're very, very fortunate that we're only a 2-hour beautiful view drive down here. So Mayo, we're very happy here.
Basically, our lives are very normal in the sense that we're pursuing exactly the same interests that have motivated us throughout our lives, and that all of that has returned, and as I said, that the quality of our life is really outstanding.